So as a GI doctor, what do I think about when someone tells me they're having diarrhea? I can't begin to cover everything in 90 seconds, but here's some basics. How long has it been around? Is it chronic or acute? Acute diarrhea, which is diarrhea that's been around for less than 4 weeks, is most likely from an infection, but it could also be from something like a side effect to a new medication, for example. Chronic diarrhea is often less obvious, so the details about it make a big difference. Chronic diarrhea can be from almost anything: infections, medication side effects, celiac disease, thyroid disease, inflammatory bowel disease, diet, IBS, malabsorption. We ask questions to try to differentiate between these. Like if you have blood in your stool, for example, it's unlikely to be a medication side effect or IBS. If you have no diarrhea when you skip a meal, then it's more likely going to be due to something that you're eating. We can't always be completely sure of what the cause is after just talking to you, so we often have to order tests. Blood tests looking for thyroid levels, high white blood cells, inflammatory markers or celiac antibodies, stool tests looking for infections or signs of inflammation. We can check something called fecal elastase to see if chronic pancreatitis could be causing your symptoms. Low levels of this enzyme make it hard to break down and absorb fats, so the fat stays in your stool and causes really smelly diarrhea. If blood tests don't give us an answer, we often recommend an EGD and a colonoscopy. These allow us to inspect and sample the lining of the GI tract. We sample the duodenum to look for celiac disease and different parts of the colon to look for ulcerative colitis or microscopic colitis. Microscopic colitis is inflammation that can result from different medicines in many cases. Treatment for diarrhea depends on the cause and can range from steroids to antibiotics to a gluten-free diet, depending on your diagnosis. If all of your tests come back normal and your symptoms are consistent with it, then IBS becomes more likely, and we can focus on antidiarrheals like loperamide or Lomotil. These medicines are easy to take and are usually effective, but for many causes of diarrhea, they can simply be acting as a band-aid and masking the problem. That's why it's important to have tests done to make sure nothing is missed. Remember to talk to your doctor about your specific circumstance because there's a lot of nuance to this.